Hi and welcome back to another episode of Living Well with Dr. Thanuki. Today the topic of discussion is coronary heart disease or cardiovascular disease, and this is the number one killer in the world. And this accounts for about 17.9 million deaths worldwide annually, and in Sri Lanka accounts for about 23% of the deaths annually. And it's also the most common cause of sudden death. Men are 10 times more likely than women to develop coronary heart disease, and if you're over 65 years of age, there's a greater risk of death. And the cornerstone of controlling this disease revolves around decreasing the LDL or the low density lipoprotein cholesterol by using statin drugs and lifestyle modification through diet and exercise. What causes coronary artery disease or heart disease? It's mostly because of the narrowing of the blood vessels that supply blood to the heart, and this happens mostly due to atherosclerosis and plaques that build within the walls of the vessels that can break away and then block the blood supply to the heart. And about atherogenesis and plaque buildup, we discussed in the topic of lipid disorders. You may refer to that video. Cardiovascular disease can be categorized to three different components. So it can be cardiac disease, so within the heart itself, or it can be vascular disease of the brain and the kidney, or peripheral arterial disease. But this is a summary of what happens during the development of the atherosclerotic plaque, which leads to coronary heart disease. So if we are to talk about the types of heart disease, so there is stable angina or angina pectoris, and there is unstable angina, there is cardiac arrhythmias, and there's also MI or myocardial infarction, which is the most common, and heart failure. So we'll be talking about each one of them. Stable angina usually occurs with regular activity upon awakening, and it is usually worsened with cold temperature, high altitude, and things like that. And it's because of high-grade narrowing of the coronary arteries. Treatment is usually nitroglycerin or nitrates, and you can take it sublingually or orally. Unstable angina is angina or chest pain that changes in character, intensity, and frequency, and may precede MI or myocardial infarction, or what we call a heart attack. And this is a medical emergency and needs immediate attention. Angina pectoris or stable angina can be classified according to its severity. So there's class 1, 2, 3, and 4, and it's usually categorized based on when the chest pain is present and like how you can jog, at which speed you can jog or walk, and other symptoms. So this is a summary of how you classify angina pectoris. Cardiac arrhythmias can be categorized into atrial, ventricular, or atrioventricular, and they can be because of coronary heart disease, post-MI or post-heart attack or post-myocardial infarction in that case, or after heart surgery. And then this can lead to ventricular dysfunction. Rapid ventricular dysrhythmia can lead to even cardiac arrest. Ablation and implantable defibrillator is a choice of treatment for cardiac arrhythmias. And cardiac dysrhythmias or ventricular dysrhythmias can be because of physical activity. So this is called exercise-generated ventricular dysrhythmia, and it can present as lightheadedness, dizziness, and syncope. In patients who have cardiac arrhythmias, it is advisable to graduate the workload progressively. So if you are exercising, you must always warm up and cool down, and then increase the intensity of the workout gradually. and there should be no sudden cessation of the moderate intensity or rigorous intensity workout. And always must avoid Valsalva maneuver and working against very heavy resistance and very high intensity training where you are exerting against an isometric load. And must also avoid positions of yoga like hatha yoga, where you have inverted positions and where your heart is below the head. That must be avoided, and must always cool down and warm up properly, and be very cautious, and you have to always be observed by a professional 10 to 15 minutes after exercise. So when discussing the MI, or the most common cause of death, it's myocardial infarction or heart attack, as we say. It's usually because of the plaque rupture, the atherosclerotic plaque rupture, that causes hypoxemia or less, a state of less oxygen, or ischemia of the heart muscle cells that happens below the level of the blockage. So in this case, what happens is that the patient usually experiences chest pain for more than 20 minutes, and usually on the left side it's common, and radiating pain is usually not localized, it's diffuse. Sometimes it radiates to the jaw and the neck area, and can even be like coming as epigastric pain or mid-back pain. And there may be diaphoresis or sweating, nausea, vomiting, and those kind of symptoms may also be present, and it's not changed by movement and tenderness to touch, all of these things, and then breathing pattern movements will not affect someone with going through a MI or a heart attack. And the best way to identify them is we'll be talking about the diagnosis. How do you diagnose MI? So apart from the physical symptoms, you can do ECG, you can do troponin levels and CKMB, and that's how you diagnose it. And women may experience shortness of breath, fatigue and weakness. But 1/3 of all MIs or myocardial infarctions are silent. And in more than half of these cases, it is usually the first cardiac event. So that's called acute coronary syndrome, accounting for about majority of new cases of heart diseases. Acute MI or acute coronary syndrome is a frequent manifestation of coronary heart disease, and usually in about 50% of the cases, this is the first indication of coronary heart disease. This is a common question that we are asked as to when a person who has had a heart attack or MI recently and how they should begin their exercises and how they should continue their exercise routines again. So it is important to obtain a letter from a physician. You need to get clearance. ECG is required, and preferably or definitely we must have cardiac rehab and supervised exercise treatment as a part of recovery before you begin exercising in a healthcare or fitness facility. So anyone who's had MI in the recent past, so within the last 8 to 12 weeks, need to increase the workload gradually. Like they have to start at a lower metabolic equivalent, so 3 to 5 metabolic equivalents, that level you should start at, and gradually progress slowly. So and it's important that if the exercise ECG is normal and you have no symptoms, they can you must be aware that they can proceed like normal people, and over the next 6 to 12 weeks, 6 to 12 months in their fitness journey. heart failure is a complication of MI or heart attack, and that is a state of decreased cardiac output where you cannot meet the body's metabolic demands with it, even at regular physical activity levels. So it can be left-sided or right-sided, and diabetic patients are more prone to developing heart failure. And those who have heart failure are at risk for developing exercise intolerance. So states like where they are unable to do a workload at a very low intensity, and having symptoms like dyspnea or shortness of breath despite working against low intensity are signs of exercise intolerance. Physician clearance is usually needed before a patient with heart failure begins an exercise program. And some clinical manifestations of heart failure include dyspnea, which is shortness of breath with physical exertion, orthopnea, which is shortness of breath when lying down, and resting heart rate of more than 100, and also lower extremity edema, like peripheral edema, and cold, cyanotic, pale extremities, and exercise intolerance. These are some signs of heart failure. Fluid retention, especially in the lower extremities, and the weight gain are some key features of heart failure. These patients with heart failure need to start the exercise program with caution at a low intensity and low workload level. So at about 2 to 5 metabolic equivalents they should start and progress slowly, and can go up to about 50 to 70% of the VO2 max, and but must be gradual through gradual improvement, and going to high vigorous activity levels to improve aerobic power at given period of time. It's okay, and it does not cause deaths, and but must be done with clinical supervision and caution. Some of the investigations that we can do for patients with coronary heart disease include ECG, and there's the stress ECG and exercise ECG that we can do, and radionuclide studies, and you can do echo, coronary angiography, and also the calcium scoring. Coronary calcium scoring is another important investigation that you use when we devise what's called the coronary calcium scoring or the Agatston score. And coronary calcification is occurring in the process of atherosclerosis, and it doesn't occur in normal vessels. So the coronary calcification score is showing the amount or the burden of the plaque that is there with atherosclerosis. So coronary artery calcium is a measure of the burden that an individual has atherosclerically. So the more calcium you have, it's more likely that you have atherosclerotic risk of and developing heart disease. So the score ranges anywhere from 0 to 400 plus, and the risk increases when the score increases, and this is a summary of that. So the treatment options are medical, surgical, and there's exercise, nutrition, and lifestyle modifications. So if you talk about medical therapy, there are beta blockers, they have ACE inhibitors, angiotensin receptor blockers, calcium channel blockers, and nitrates, and all sorts of drugs. And when it comes to surgical intervention, there is percutaneous transluminal coronary angiography or an angioplasty. This is called PTCA. That's what we call putting stents. Percutaneous transluminal coronary angioplasty. And there is what we call CABG or bypass grafting, coronary artery bypass grafting, what we call heart surgery. Those are the options medically and surgically, and we will talk about the lifestyle modifications as well. Any patient who's had cardiac intervention needs to be symptom-free, have proper ventricular function, have no abnormalities in the ECG, or it should be stable, and must also be able to control his or her blood lipid profile and blood pressure aggressively. For those who have undergone CABG or coronary artery bypass grafting, it is important to avoid heavy resistance training for about 6 weeks post-surgery to recover from the sternotomy that they had undergone, and they must also go through in the first 4 to 6 weeks some upper body range of motion, and some yoga exercises are also recommended, but you shouldn't put pressure on their back or the sternum. Coronary angioplasty or PTCA, or what we call putting stents, does not have a survival benefit. However, lipid lowering drugs like statins, they do have a benefit in reducing mortality, and we must understand when the risk of when someone undergoes restenosis, they might present with fatigue and also chest pain, and having poor exercise tolerance, especially at the workload that they used to. So we must follow up with patients who have had these procedures and observe them carefully. Cardiovascular disease prevention with lifestyle modification is quite effective, and it revolves around lowering the LDL cholesterol, or the low density lipoprotein cholesterol, by consuming a diet that is rich in fruits and vegetables, like high in fiber, legumes, whole grains, low fat dairy, lean protein like fish and chicken and poultry and seafood, and then also that is low in saturated fat and trans fat, and low in sugar, and this usually can be achieved through the DASH diet pattern, and also there's Mediterranean diet that is also quite popular. Blood pressure also must be controlled to achieve success in this lifestyle modification and to control cardiovascular disease. And this can be done by decreasing sodium intake and also following the similar steps that we mentioned with the dietary patterns just a few seconds ago. And you can also watch the video we did on hypertension and the lifestyle modifications you should follow. We did it in depth, but in general you must reduce sodium intake to less than 2,300 milligrams per day. Those who have reduced it to more than 1,500 milligrams a day have greater reductions in blood pressure, and at least we must aim to reduce it by about 1,000 milligrams from what we consume. And we must combine the DASH diet pattern with lowered sodium intake. It will have greater success. The physical activity recommendations to lower the blood pressure and to lower the LDL cholesterol revolves around doing aerobic activity. That is recommended amount is about 3 to 4 times a week, about 40 minutes a session, and in moderate to vigorous intensity. It is recommended to seek the assistance of a registered dietitian, a medical nutrition therapist, or a physician, or somebody with a lot of experience in handling these kind of clients, to help bring your weight down, to help lower the LDL cholesterol, bring down the triglyceride levels. That will help you, achieve a lower risk profile in this cardiovascular disease management. So we again advise you to seek seek assistance from someone who is experienced in this field to get a customized diet rather than randomly going with what is on the internet or what someone says. The recommended macronutrient composition for someone with the goal of wanting to lower the LDL cholesterol is as follows. So we recommend you to take carbohydrates 45 to 60%, fats 25 to 35%, and then 15 to 20% in protein. Recommend you to decrease trans fats, what we call the animal fats, and replace as much as possible the saturated fats with unsaturated fats, like from tree nuts and omega-3 and all that through seafood and things like olive oil. So these interventions will help you decrease your LDL level by about 16%. Some other cardioprotective nutrients are omega-3 fatty acids, tree nuts, and then plant stenols, sterols, also fiber, and alcohol in moderation, and B vitamins. As per congestive heart failure patients, protein requirement is more. They need more protein, so especially with stable depleted clients, patients, they need about 1.37 grams of protein per kilogram of body weight for men, and for women it's about 1.12. And fluid restriction usually helps symptoms like edema and fatigue, and fluid requirement usually varies with the symptoms, and decreasing sodium intake or salt reduction. Sodium reduction does help control this, and then the recommended diet is quite similar. Decrease fats, focus on eating more whole grains and fiber, and reducing refined sugars and stuff. Yeah. Thiamine and folate supplementation usually is required and is helpful in patients with congestive heart failure. And Ornish and Mediterranean types of diets are recommended, and we have discussed them in our previous episodes, especially with blood lipid disorders and hypertension. So here's a summary of what the Ornish and the Mediterranean diet is like. There are so many benefits in following an exercise program for those who have stable cardiovascular heart disease. So those patients experience increased aerobic power, increased VO2 max, improved endothelial function, and so many parameters would change, like triglycerides would come down, LDL, CRP, body fat percentage, and HDL cholesterol would go up, which is a plus, and also the ischemic threshold is raised. So and also these patients who are regularly exercising, they have a sense of self, esteem is kind of improved, and then risk of being depressed is lower. So it's overall a great thing for patients with coronary heart disease to engage in a supervised and tailor-made and well-planned exercise program. So how do you devise a program for stable cardiovascular disease patients? It is based on the risk factors, and we will talk about the risk factors in a little bit. So you can classify them into low risk, moderate risk, and high risk. So low risk is if you're asymptomatic and you have less than 2 risk factors. Moderate risk is if you have you're asymptomatic and you have more than 2 risk factors, and you are falling into the high risk profile if you are already a known cardiovascular disease patient, renal or metabolic or pulmonary or any other condition. If you have, you do fall into the high risk category. So if you are a low risk patient, you do not need a medical exam or a exercise test prior to beginning an exercise program. If you are moderate risk, for moderate intensity exercise, you do not need an intervention. However, vigorous intensity exercise program, you need medical clearance and an exercise ECG testing. And but if you are a high risk one, you need both for moderate and vigorous intensity. You need a medical clearance exam and also ECG testing. So we differentiate between moderate intensity and vigorous intensity with the VO2 max. Anything from 40 to 60% is moderate intensity, anything more than 60% is vigorous, and then 3 to 6 metabolic equivalent is belonging to the moderate intensity category, and anything more than 6 metabolic equivalent is in the vigorous intensity. And in vigorous intensity exercise programs, you can see a noticeable change in heart rate and other parameters. I think we discussed the atherosclerotic risk factors for cardiovascular disease, but we'll summarize them again. So age, if you are more than 45, if you are a male, and female more than 55, that would give you a +1 point. And cigarette smoking, sedentary lifestyle, LDL levels of more than 130, and HDL levels being low, and also having family history and obesity. Those are risk factors that would give you +1 point. The only thing that would counteract and give a -1 point is having a high HDL level of more than 60. Signs and symptoms of a cardiac event include chest pain that would radiate to the jaw, arms and the neck, and shortness of breath even with mild exertion, and orthopnea, that is difficulty breathing when you're lying down, and paroxysmal nocturnal dyspnea, which is shortness of breath or difficulty breathing when you're sleeping, especially during the first 2 to 5 hours of sleep. And tachycardia, and that means increased heart rate and palpitations, lower extremity claudication, it's a cramping sensation and pain in legs, and symptoms like this that would indicate that there is a cardiac event should seek immediate medical attention. The contraindications to exercise in those with cardiac disease include unstable angina, uncontrolled blood pressure, that is having blood pressure of more than systolic blood pressure of more than 180 and diastolic of more than 110. Orthostatic pressure drop of, that means if you're sitting, lying down and standing, the pressure drop of more than 20 would indicate a change that would be a contraindication to exercise. And also sinus tachycardia of more than 120, recent embolism, thrombophlebitis, also aortic stenosis, and any orthopedic condition, and any systemic illness, uncontrolled diabetes. All of these are contraindications to exercise in those with cardiac disease. So those with a low risk can exercise at about 7 metabolic equivalents in capacity, functional capacity. Moderate risk, again 5 to 7 metabolic equivalents depending on their capacity and risk factors. And those with high risk need to keep it below 6 metabolic equivalent, and we have to observe the other parameters if they have normal ECGs, normal signs and symptoms, and no obvious warning signs. As per the exercise recommendations, it is standard that we, according to American Heart Association, it is recommended that you exercise 150 minutes per week if it's moderate intensity, and 75 minutes per week if it's vigorous intensity. And it is recommended to do about 8,000 steps a day. Especially if you're obese or overweight, 250 to 300 minutes per week in exercise is recommended. And you can start in small intervals, in small amounts, and then progressively add up with time. Signs and symptoms of excessive effort in cardiac patients include chest pain, dyspnea, that means shortness of breath, and decrease in blood pressure despite the increasing workload, and a blunted heart rate response to exercise. This is called chronotropic incompetence that usually happens with drugs like beta blockers, and also palpitations and arrhythmias like ventricular arrhythmias. Those are also signs and symptoms of those who are having medical emergency. It is definitely recommended to exercise at least every other day in 30 to 60 minute durations at least. And if you are trying to control risk factors like diabetes, obesity, dyslipidemia, and metabolic syndrome, it is recommended to work out more than 60 minutes per day. It can be short durations that add up, and recommended to do like a calorie expenditure of like 1,000 to 2,000 calories per week. It is important to remember that we must focus on large rhythmic muscle group movements, and then to focus on whole body physical activity and calorie expenditure, and that we must use a fan for cross ventilation and to promote evaporative heat loss and cooling that would decrease the work on the heart. And we must also remember that some stationary cycles can increase blood pressure, so must use them with caution. And it is important to always warm up and cool down adequately. A HIIT workout, what we call a high intensity interval training workout, is also beneficial for 30 minutes or more if you don't have any symptoms, for those patients who are stable. And in the first 8 to 10 weeks, it is quite beneficial to do this and to improve your aerobic capacity. So it is important to understand that we must, whatever we do, we must do it progressively and increase intensity step by step, and not all of a sudden. And that certain movements, like certain upper body movements like arm cranking and rowing, can increase the blood pressure, so those exercises should be avoided until it's safe to do so. And we must, whatever we do, we must progressively increase the intensity and monitor with caution. We must also refrain from the Valsalva maneuver or any breath holding maneuver or anything that would put a heavy resistance and make you hold your breath against, like isometric contraction. That sort of exercise is not advised. If you are a patient who has stable angina and you have symptoms, it is recommended to discontinue the exercise and then administer nitroglycerin, either spray or sublingually or orally, and monitor again. If symptoms don't improve or if it worsens, it's important that you call an ambulance immediately and seek medical attention immediately. If you are in the low to moderate risk category or high risk category, but with supervision, you can perform resistance training or strength training exercises 2 to 3 times a week and progressively increases intensity. You can increase the upper body weights by upper body weights by 1 to 2 kilo per week and lower body by 2 to 4 kilos per week, and improve your muscular endurance. And the number of sets can vary from 1 to 3 and reps anywhere from 8 to 12 or 15 or whatever is comfortable. You can start slow and then progressively increase, and you can use elastic bands, resistant bands, free weights, selectorized machines, and improve your muscular strength, and that will all help in keeping your weight low and achieving your preferred lipid profile. So that was cardiovascular disease in a nutshell. We primarily focused on disease modification through lifestyle interventions, through good nutrition and exercise. And as a medically oriented fitness center in Sri Lanka, we focus on preventing non-communicable diseases and managing them with exercise and good nutrition. So we have both online and in-person services. So if you're someone who has heart disease or who has had it in the past, we had bypass surgery or diabetes, lipid problems, or any other hormonal problems or even cancer, and you want to resume your fitness journey or use the fitness journey to improve your health, and you have any questions, please don't hesitate to contact us. We can offer you a customized nutrition plan and exercise plan that you can either do at a gym or in your home, and you can obtain great results with, and we will supervise you medically as well. And if you have any questions, please don't hesitate to contact us. I hope to be back next week with another topic. For more information about our program, please DM us, please like, share and subscribe to support our channel, and we hope to be back next week with another topic.